Good afternoon. My name is Tanya, and I will be presenting a pediatric practicum case involving a 17-year-old female who presented for a routine sports physical. The patient is a 17-year-old female who presented to the clinic accompanied by her boyfriend for a pre-participation sports examination. During the initial encounter, the patient was noticeably quiet. She avoided eye contact with me, and she allowed her boyfriend to answer majority of the questions that I was directing towards her. This behavior raised concerns for me regarding possible coercive control or interpersonal violence. On physical examination, I observed multiple bruised areas on both forearms in various stages of healing. Because of these findings, I politely asked the boyfriend to step outside the examination room so that I can complete the remainder of the visit properly. This is standard practice for adolescent patients. Once alone, the patient remained hesitant, but she gradually became more willing to speak after reassurance regarding confidentiality and the limits of confidentiality related to her safety. She denied any acute medical complaints, including pain, headaches, dizziness, loss of consciousness, or recent illnesses. Initially, she stated that the bruises were accidental. However, after additional open-ended, non-judgmental questioning, she disclosed that her boyfriend becomes physically aggressive during arguments and he has grabbed and pushed on her several times. She reported feeling frightened and admitted that this has happened on multiple occasions. She denied suicidal ideations as well as homicidal ideations. Her past medical history was otherwise unremarkable. She denied chronic medical conditions, previous surgeries, or medication use. Immunizations were reported to be up to date. She denied tobacco, alcohol, or illicit drug use. Family history was non-contributory. The focused physical examination revealed an alert, appropriately developed adolescent female in no acute distress. Vital signs were stable. Skin examination determined multiple bruises of varying sizes and colors over both forearms without evidence of open wounds or fractures. No additional traumatic injuries were identified on the examination. Neurologic, cardiovascular, respiratory, and musculoskeletal examinations were otherwise within normal limits. Based on the history and physical findings, my primary diagnosis was suspected adolescent intimate partner violence with physical abuse. The differential diagnosis included accidental bruising related to sports participation, bleeding and clotting disorders, and non-accidental trauma from another household member. However, the patient's disclosure, the pattern of the injuries, and the presence of the bruises in different stages of healing strongly supported intimate partner violence and most likely the diagnosis. The management plan focused on ensuring the patient's immediate safety while maintaining a trauma-informed approach. First, I validated her disclosure. I thanked her for trusting me, and I assured her that no one deserves to be hurt. I completed a safety assessment to determine whether she felt safe returning home or whether she was in immediate danger. The injuries were carefully documented, including the size, the location, the color, and the appearance of each bruise. Appropriate body diagrams and photographs will be obtained according to the clinic policy. Because the patient is a minor, I followed the state's mandatory reporting requirements by notifying Child Protective Services and consulting with the supervising provider as well as the social worker. If there had been concern for immediate danger, law enforcement and emergency protective services would have been notified immediately. The patient was provided with information regarding community domestic violence resources, counseling services, and crisis hotline information. A personalized safety plan was discussed, including identifying trusted adults, emergency contacts, and safe locations should the need for immediate assistance occur. She was instructed to seek emergency medical care immediately if additional violence occurred or if she experienced worsening injuries. Arrangements were made for close follow-up within 1 week with her primary care provider and behavioral health services. In summary, the case highlights the importance of recognizing behavior warning signs of adolescent abuse, interviewing adolescents privately, conducting trauma-informed assessments, document findings thoroughly, and fulfilling mandatory reporting responsibilities to protect vulnerable patients. Thank you for listening to my presentation.